Hello everyone, my name is Rita Maliza. I'm from Andalas University, Program Study of Biology. Now, I would like to present my study is about analysis and subchronic toxicity tests of coffee Arabica pulp extract on mice, musculus L. We know Indonesia is a subtropical country, a great potential for developing primary commodity coffee plantations. And then in Indonesia, wet coffee processing produce 40 until 50% of coffee pulp waste. And previous study reported that skin of coffee, pulp coffee, useful for food and health drinks like cascara tea and bioethanol, and also produce mushroom fermentations. Then the pulp coffee contain bioactive secondary metabolite like a tannin, flavonoid, and polyphenols and caffeine. Since no report on the subchronic toxicity of coffee pulp extract, now we want to analyze future experiments, and this study purpose to determine the subchronic toxicity effects of oral consumptions of methanol extract of the coffee pulp extract with a variance of dose on biochemical and histopathology. In this study, we use the method first preparations of coffee pulp methanol extract, Arabica coffee pulp we got from coffee plantation farmer in Tegamulyo village, Tenggalrejo district, Klaten Regency, Yogyakarta, Indonesia. And the material were set right under room temperature, and then we extract using methanol 96%. And then we continue analyze the active compound, use the gas chromatography, mass spectrophotometry, and then the animals models, we use mice, biopsy mice, and then in subchronic toxicity study, we treated with oral toxicity for 26 days, was determined according to BPOM test guideline 2014. We divided in this study into 5 group, experimental group, and then we continue, we collect in the last day, in 29th, we collected liver tissue for analysis histopathological study, and then also biochemistry enzyme, level of SGOT and SGPT. And then we use statistic analysis. You compare between group were performed using one-way analysis of variant ANOVA. And this is the result of our study. We can see the ratio of body and liver which mice after treated orally with an extract of coffee pulp for 28 days was not significantly different, and then between the control group, and then the treatment with coffee pulp extract with variance dose. And then we can see this histological image, liver tissue using hematoxylin, eosin staining, each variant group and control. Hepatocytes are responsible for the central role of the liver in metabolism. These cells located between the vascular sinusoid and then with the hepatic artery and portal veins. Microscopic observations show the result there. Necrosis cell in the control group and then variance dose. And also we can see in this figure, there are some inflammation. And then we analyze and calculate and analyze the cells, necrosis cell. We found that the hepatocyte necrosis data was significantly different between the control and treatment group at each dose. The data show that those variation affects liver tissue necrosis cell of mice treated with coffee pulp extract for 28 days. And then this is the result of enzyme level after treatment orally with ethanol extract of coffee pulp for 28 days. We found that from the result, SGOT and SGPT enzyme level at those 75 and 250 and 500 kilogram weight body had the same mean value of the SGOT enzyme. And from the 1000 milligram per kilogram body weight show a high level SGOT and SGPT enzyme. And the data was significantly different from the control group. And this slide show GCMS analysis of ethanol extract the coffee pulp. We can see this slide show. Okay, in this slide show GCMS result, we found that 43 peaks, which indicating the present 43 phytochemical constituents. And then we compare this peak with NIST 14 library, and then we found that 18 phytocompounds were characterized and identified. And the number 3, 4, 7, and then until 14, this compound have a high percentage in the ethanol extract of coffee pulp. So this is the like a result of our study, subchronic toxicity analysis from the coffee Arabica, and then we extracted, we got the ethanol, and then we continue to analysis the phytochemical compound with GCMS, and then we treated on mice, we got the percentage of necrosis cell, and then SGOT, SGPT level enzyme. The conclusion of this study, in the study show that 1000 milligrams per kilogram body weight dose of coffee pulp extract has a toxic effect on increasing the enzyme level SGOT and SGPT. Then the subchronic toxicity effect was an increase in the number of necrosis cells and accompanied by inflammatory cells. Thank you very much for the attention.